Auditor General Gathungu has said that the procurement process of the Social Health Authority system did not follow due diligence, hence the gaps. Now, despite investing 104 billion shillings of public funds into the digital system, the state neither owns nor controls the system. This comes as doctors and civil servants have threatened to down their tools in 2 weeks' time following the lack of a comprehensive cover under the Social Health Authority. They say despite being subjected to monthly contributions, they and their beneficiaries cannot get services. Helen Aura with more.
6 months into the implementation of the Social Health Authority, the government maintains the 104 billion Kenya shillings used for the implementation of the digital health system are to enhance the implementation of universal health coverage through the authority. As those who previously questioned the funds used were quickly shut down, today the Auditor General Gathungu has boldly indicated that Kenyans may have been shortchanged in the implementation of the digital health system.
So already I have concluded that there was no effectiveness or lawfulness in the use of public resources under those matters. Then I have the third section that now looks inward into the entity in terms of governance, in terms of risk management, in terms of the internal controls the Honourable Member is raising. Internal controls are not being followed. The governance structure has problems.
Gathungu says the government does not have control of the system, which requires an annual payment of 10 billion Kenya shillings for a period of 10 years. She further explained before the Senate Committee on the County Public Accounts.
We agreed before this committee that we want to terminate that contract and what are going to be the consequences, because we can't continue to allow people to enjoy proceeds of crime. Let's just declare this SHA and SHIF a criminal enterprise, and we close it today.
Role and responsibility for action on the Auditor General's reports is with Parliament.
While leaders across the country are hailing the Social Health Authority, the Kenya Medical Practitioners, Pharmacists and Dentists Union and civil servants have openly pointed to the failure of the Social Health Authority.
Public servants here, the civil servants, are contributing twice. They forfeited their medical allowance, and at the same time, they're contributing 2.75%. But this scheme has fallen short of expectation of the civil servants. We are more frustrated. We are more overwhelmed. We are more distressed because all the civil servants, with all their dependents, are unable to get care in any of the hospitals that they visit.
The Public Service Ministry, which is in charge of this medical cover, we want them to come out openly and declare that they have failed to protect our interest in the government.
As the Kenya Kwanza government pushes for the implementation of UHC for the 4th time, concerns have emerged over who is or are the beneficiaries of the fund, as the government is also being accused of detachment to the concerns and needs of the common man's health needs.
The ongoing divide between the state and health workers seems to bring out the rot in the health sector. As KMPDU now threatens to down their tools in 2 weeks' time, Kenyans will now end up bearing the brunt of the divide and empty promises. Helen Aura, NTV.